The University of Puerto Rico School of Medicine was established in 1950 to train doctors to meet the needs of the island. To meet its mission, the school's faculty, staff, and trainees are trusted partners for many diverse communities on the island. These communities include the elderly, working poor, homeless, intravenous drug users, environmental organizations, and governmental agencies. Working with these communities, students and faculty have created dozens of sustainable resources that address community-identified needs and build the capacity of community partners. In the aftermath of Hurricane Maria, the strength of these community partnerships and the resourcefulness of the University of Puerto Rico School of Medicine was on full display. Students, faculty, and staff worked quickly to build a communications network with community partners, organizing a command center and interdisciplinary brigades that enabled them to meet the needs of their neighbors.
Well, we're very honored to have received the distinction. Our medical school has been very intimately involved with providing care to the underserved in the island since its inception. We don't have much in Puerto Rico. We're a poor island. With the little we have, we do a lot. And that is a direct result of the commitment and the passion of the people who live there, including our medical students. Certainly there are many people to thank. Obviously, this has been a joint effort. I have to admit that my participation has been small. First of all, the communities which welcome our students and embraced their being there and worked together with them to develop their self-sustaining projects. The medical students, for sure, without them, I wouldn't be here sitting in this chair. There's a doctor, Aurines Torres. She's a professor of pediatrics who leads our social outreach program, and she really deserves a lot of credit. Our development office chairperson, Cynthia Hernandez, Dr. Debora Silva and Dr. Nerian Ortiz, who work intimately with the medical students, and certainly the former dean, Dr. Edgar Colon, who was really the person who spearheaded this effort to participate. I'm sure I must be leaving people out, and I beg for their indulgence and forgiveness.
For me, it has been a pleasure to work at a place where one of its core values is social responsibility. In this regard, we have been involved in community work since the early 1980s. From residency programs embedded in underserved communities to participatory research with marginalized communities, our work has been constant.
We are grateful and honored to have the confidence of many community organizations that provide the opportunity for our medical students to learn from their community wisdom and allow them to contribute to the titanic and heroic work that they do every day for the health of our communities on the island. In the real-life scenario, students are fully immersed in a community under serious inequality condition. They listen, observe, become witnesses, they reflect and question these realities, and they propose and act along with community members to find sustainable solutions.
I work with community partners in Campus to the Street, a branch of Operation Compassion of Iniciativa Comunitaria, through weekday street rounds around our campus. We deliver food, medical care, prevention kits, items of basic needs, and most importantly, we give our company. Sharing conversations with participants is critical in our philosophy.
When Hurricane Maria hit the island, all the hospital personnel, including residents, were activated to act in the help of our community. By organizing our manpower and resources, we were able to impact over 40 municipalities by doing needs assessment, providing essential resources, doing medical evaluation, donating medications, and becoming active advocates for the evaluated communities. We also help empower those evaluated communities by educating children, families, and active leaders in order to help prevent public health issues that were emerging.
So, for an LCME accredited medical school in one of the most financially challenged territories of the U.S., teaching the importance of working with the communities to improve the health of the people of Puerto Rico is a challenge that we more than meet, we exceed.